Mili is a consultant in specialist care dentistry at the Surrey and Sussex Healthcare NHS Trust. In 2015, she started the Mouthcare Matters initiative to improve oral health. She's developed the resources for that programme, which remain available and which we found very helpful here in Salisbury. I understand that she's been previously awarded an MBE for her work, and we look forward to listening to her as she shares her experience. The title of her presentation is Why Mouthcare Matters.
Okay, well, thank you very much. I'm assuming you can all hear me and see my screen.
Yes, thank you, Mili.
Brilliant. Okay. Well, first of all, thank you so much, Graham, for inviting me today. I am delighted to speak about Mouthcare Matters, which is a topic that I am very passionate about, and the team I work with is very passionate about. And what I love about this meeting is that it is run by a medic, and Graham has put this together because over the last 7 years, a lot of what I've been talking about is that the dentists and everyone that is a speech and language therapist and a dentist on this call knows the importance of mouth care and knows how poor standards are in hospitals. But this is sometimes not appreciated amongst our other professionals. So it is great to be able to speak here. So let's start at the beginning. I'm going to talk a little bit about the programme, and today a lot of people are going to be speaking about the evidence base and the links between poor oral health and general health and how it all works. But we have to sometimes go back to what we call, I'm not going to call it basic care because mouth care isn't basic care. It is fundamental, essential care that sometimes and often doesn't get done as well as possible. And if we're talking about all the clever things and all the interventions we need to do, at the end of the day, there are people in every hospital in this country where nobody is looking in their mouth, nobody is giving them the support they need, they don't have access to toothbrushes, and they don't get the mouth care that they need. And this has an impact on their overall health, and this is sometimes not appreciated amongst healthcare professionals. And this isn't me having a dig at healthcare professionals, because we know, we've seen how hard everybody works. But mouth care is just one of those topics, one of those aspects of care that has just somehow flown off the radar, and there are no standards, etc., or there weren't. Hopefully it's better now. So in 2015, I was asked, I just started my job and I was given a role. I said, with some funding from HE, can you go and improve the oral health of hospitalised patients? There was an excellent project going on in the community, but they wanted to do a small project called on mouth care in hospitals. And I work at East Surrey Hospital, and this is a typical hospital. It's a good hospital to work at. The staff are great. It was good. It's now expanding, and it probably represents all other hospitals probably in this country. And I took off my dental hat. I didn't go as a dentist, and I spent a lot of time with other mouth care leads on the wards, and it was actually an eye-opener. It was a shock how little people understood about oral health, how there were no standards, there were no policies, there was no training. Most people, there wasn't even a toothbrush on the wards. And so we started as a blank, and what we did was we worked together with the rest of the team to start thinking about, we need to improve the standards. How do we do this? And we tried lots of things that worked, things that didn't work, and we continuously evaluated it. And we were able to then to show the importance of this programme through generally the patient's story and get support from the trust, which enabled us to get funding to roll this programme out to every trust in Kent, Surrey, Sussex, and there are 13 in total. And each trust was funded for a mouth care lead for a year to show, and we worked together to set standards. Now, we got a lot of interest in the programme, lots of people saying this is great, and we were able to then get some more funding to try and support other trusts, which we did another 40 or 50 in the country, and then also started our mini Mouth Care Matters programme as well. Now, the programme has ended, but every week I get things on Twitter, I get messages through the website, I get emails from people saying, mouth care isn't great, I really want to improve it, can we use your resources, etc. And the reason I do, and the type of people, they aren't the sort of chiefs of nursing or the chiefs of people sitting in offices. Generally tends to be students or people that have just qualified and then have seen that mouth care is really, really poor on the wards, and they see that excellent care that our patients get, but they sometimes see that mouth care isn't as good as it should be. And hence, that's why we called the programme Mouth Care Matters. So we arranged, as the programme, the sort of initial programme has ended, there are a range of resources that we try to leave legacy documents. There's some here, there are toolkits, etc., because and videos, that we would hope could be shared and people could adapt, because I'm not saying we did everything perfectly. There were things that we did which, you know, we needed to change, but we really wanted to share the work that we did so that other people could learn from it. So really importantly about this, when you talk about mouth care, people think this is a program about brushing people's teeth or cleaning people's dentures. But I was really keen with the team that I worked with that we showed the patient's story. Now all these pictures were taken, all the pictures that I show in this presentation were taken by myself or my team with the appropriate consent, to just highlight what people's mouths are like in hospitals. And you can see there were patients that it was a shock. There were patients that had mouths that were very, very dry, had secretions that were almost sometimes affecting their bleeding, patients that needed support with toothbrushing and weren't getting it, dentures that had been in the mouth where actually mold was growing on them, had lots of patients who had medication. We've seen this quite a lot. The mouths are so dry, where medication was actually stuck to their mouths. And we really needed to show these stories, because this wasn't just about improving standards. There was big patient safety issues, infection control. It always used to make me sort of wonder as I walked through the hospital and there's all that deep cleaning, or every time you've got a cannula in and you're cleaning the skin so that you don't introduce bacteria. You look at these mouths, as we're going to hear today, what happens? Mouth is very vascular, things are absorbed and things are inhaled. And if you had a mouth like this with all the grots that you can see in some of these pictures, what impact is this having on your body? So I'm just going to run through, I'm just going to talk a bit about some of the things we found when we initially started the programme. So I'm going to talk about the results over our 13 trusts. We found that none of them had a mouth care policy. Only a few had a mouth care recording tool, which was quite dated and weren't really fit for purpose. Only a few trusts had a training for staff, and because there was no training and it wasn't even on the care certificate, people didn't think it was important. Well, really, mouth care should be the same importance as infection control, tissue viability. And we also found that less than 50% of nurses had any training at all in mouth care. And if you're a patient on the hospital ward, you are likely to be offered a foam swab for your mouth care. Now, I can't see anyone's hands, but hands up who got up this morning, got a foam swab, dipped it in some water and swirled it around their mouth. Nobody. We don't do that. But that's what was happening on the wards. We did a survey with 32 trusts, and we found that patient compliance is a big problem in hospitals, and we all know the demographics of our hospitals. We have a lot of more older people with maybe cognitive issues, people that are sometimes have delirium, and often if you're not if you go to approach them about mouth care, and if you've ever not had anyone brush your own teeth, it's also worth trying. It's very invasive sometimes, and people don't always understand what's happening. So often, mouth care is something that, patient compliance is the main issue. And also we know the pressures and we know the time that it does take to do good mouth care, and the lack of tools. I'm a big advocate for the toothbrush to brush people's teeth, get rid of debris, but also the importance of having things like light sources, which often nurses don't carry sometimes, and healthcare assistants. We did inpatient surveys, and these are patients that can actually speak to us, and they were telling us, that they don't get the help that they would like with their mouth care, and I think that's really important. And this probably will also go for those patients that aren't able to articulate with us. We found that, when we studied notes, there was no sort of record in, about when people come in, if they have any oral care problems, but a lot of people saying that they do have problems, because when they come into hospital, their mouths can become very dry, the mouths become very sore. You can see their picture on the right-hand side, which was a safeguarding case at one of our trusts. And that was somebody that was sort of, they had a thick, 2-centimetre plug stuck to their palate. Their tongue was actually stuck to this, so they couldn't move their mouth. And if this isn't a safeguarding issue, what is? The picture down at the bottom there, I'm sure, and I with all the mouth care leads that I've worked with, all the people that have looked at improving mouth care, it's something that we see very often. Lots of plugs of secretions dried that are stuck and aren't being, and it would just make you feel horrible. If you could imagine having this stuck to your own mouth, you wouldn't want to eat, you wouldn't want to speak, you'd feel pretty terrible. I will mention dentures, because I am very passionate, as a lot of you are, about the impact. We lose a lot of dentures in hospital. And for a lot of our older people, that's it. They will never have a denture remade. They can't undergo the process, and making a new set of dentures, they won't be able to tolerate. And it affects, they can't, we've had people that have refused to see family. There are people who don't tell their husbands or wives they wear dentures, and we lose them too often in hospital, and it's something that is very poorly reported. Patients really struggle, and their families, and it is really important that it's something that every hospital has a policy on what to do if a denture is lost. So when we started to talk about mouth care, we needed the support, because we know we've got the support on the ground floor that people want to improve standards, but we need that high level support. I was very lucky in my trust. I had a chief executive that used to be a nurse, so he was quite keen. We also had a CQC visit who also said that mouth care needed to improve. That increased our ante about when we were putting on the agenda. But we made sure this wasn't a programme about just brushing or cleaning people's dentures. We made this that we linked it to the fact that it's compassion and dignity. That if you have a painful mouth, if any of us, if you had a mouth ulcer, dental pain, you can't eat or drink. If you can't communicate, the patient safety, we're going to hear about infections, frailty, length of admission, and financial cost. I'm not going to mention too much about dentistry today, but our older population, especially those who are most vulnerable in care homes, find it very difficult to access dental care. And sometimes this can sometimes contribute to things. We've had patients with dental pain that have then been admitted because they've ended up having urinary tract infections because they're not eating and drinking. The key thing was this wasn't a programme about dentists. This wasn't a programme about teaching the nurses. This is a speech and language therapy, so generally our strongest advocate. It was a programme about training every healthcare professional, from physios to occupational therapists to dietitians to pharmacists, about mouth care and the role they can play in improving standards. And that was really important. And, we talk about a lot about MDT teams, and something that we introduced was having a Mouth Care Matters lead role. Now, I've spoken to probably lots of names that I recognise. I've spoken to a lot of people, and we've done a lot of work. And if you were to ask me, well, what works? Because you can see on things like social media, people do some great campaigns and things, but they don't always make the changes. But actually having somebody in the hospital that is what we call a mouth care lead. Now, this could be a dental nurse, a speech and language nurse, a nurse. It doesn't have to be dental, but often dental nurses are very well placed, because the Mouth Care Matters lead is somebody that, similar to the infection control lead, can actually work and implement within the hospital, ensuring that there is mouth care policies, ensure that there are tools and recording tools, and ensuring that they are being actually correctly filled in and not being just a tick boxing exercise. Making sure that we have the basic mouth care products such as a toothbrush and other things that can help provide with mouth care. Providing hands-on training, because we know that just me giving a presentation on how to brush your teeth is very different than on a ward setting, but going down and helping staff, this isn't a role criticizing people, this is a supportive role in the hospital. And signposting, my mouth care lead is very good. If she sees something, we're in a very lucky position that I'm a dentist in the hospital. She'll come and tell me, oh, actually this patient's got a problem, but also they've got a tooth that is very, very, very loose and they can't eat. And often we can go down and do that intervention, that small intervention, removing a loose tooth, and they can eat again, which means they'll get better, hopefully, or it'll contribute to their recovery. And something that I've seen Graham, I've talked to him about, is, and I can do this because I know he's encouraged, that doctors get no training at all about mouth care. But if somebody has a problem on the ward, it is the doctor that needs to prescribe. And this is not being offensive, but we'll go down and we'll find patients that have been put on antifungals, like this patient here, but actually, because they think they've got things like oral thrush. And actually, it is plaque, and it really just needs to be brushed off. And something that we've done, and we always encourage, is getting our dental trainees to go and provide training for our medical team, and just giving. They don't need a degree in dentistry, but just those common things. What to do if somebody has dental pain, what to do if somebody's got a dry mouth, how to recognise signs of thrush, what to do if something doesn't look normal, because there is no training whatsoever. And I think this is something that we've always been keen. I know our geriatricians are very good and they always invite us to talk, but really it should be on the medical curriculum as well. The other problem I wanted to touch on, because it's very frustrating, is just, we talked about the MDT and multidisciplinary team. All I wanted to say there is it is somebody's responsibility. We can't just sort of say, oh, it's a dentist or it's a trust. Somebody needs to do that. So the other thing I want to talk about is, when I say this and you're going to say, well, it costs a lot of money to have a Mouth Care Matters lead, and it costs a lot of money to do the standards. But actually, one of the things that we did do was an evaluation and a cost-benefit ratio. And that, of all the studies all the things we've written up, this is probably the one that if anyone wants to read. And I think this is really important because we worked with an external team and they looked at all the money we'd put in, so all the staff costs, etc. And then they looked at all the benefits in terms of, like, for example, deprescribing mouth care products, links between aspiration and pneumonia. They used a lot of our work, and they were able to show that for every £1 you invest in Mouth Care Matters, it delivers a benefit of £2.66 within the healthcare system. And the thing that I found the most interesting, and I'm sure others on this call have, it's £17 in social benefits. And what I mean by that is we are a country where a lot of people have a lack of knowledge about their own mouth care. And by actually training staff and all levels of staff with varying levels of literacy, we did some work which showed that they not only made difference to the patient care they provided, but it also made them change their own behaviours to improve their own oral health and that of their dependents. And this is really critical because one of the things that really I found really interesting is no matter what training I delivered back in 2015 or I delivered today, sometimes we start with an icebreaker and I'd say, well, what do you do after you brush your teeth? Do you spit? Do you rinse your mouth out? And everyone would be, yes, we rinse your mouth out. One of the biggest messages in dentistry is you spit, you don't rinse, that's it. You leave the fluoride on your teeth. And if we can't get those messages out and they're not getting there, what hope do we have with other messages? So just saying that there's a need to, this program also improved mouth care in ways that we didn't actually know would do, and it's worth a read. And that's why we've been able to trust fund mouth care leads. Other trusts have also been able to do that because the leads have been wonderful, they've been amazing, they've really shown the benefit they can bring to the hospital, and they are worth their weight in gold. So going on to the end of my talk, sustainability, I'm not afraid to say what I think, and it was really frustrating. I found the Mouth Care Matters program grew very big, and it needed to be taken on by somebody who had the time, who, with all the will in the world, we're all clinicians, to really take it forward. But to do that, you need to fund and you need to have it embedded. It's not something, it's a bit like saying, okay, tissue viability, let's do some training, we'll do it for a few years and then that's it. The standards will just slip. You need it to be an ongoing program. It needs some leadership nationally, and then it needs some funding, because it will show you, we keep talking about putting the mouth back in the body, the links between oral health and general health, but we actually need to put our money where our mouths are, and we also need to care for our mouths a bit better on hospitals. But it's a range of resources. Yes, I hope we've made a difference, but really we really need to be getting into all the trusts. We need to be working and really embedding mouth care and having its importance, so it sits there. It's part of infection control, it's part of patient safety, it's a fundamental part of care. I think COVID has, with all the pressures and staffing changes, has meant that mouth care has gone off the radar again, and it's almost like sometimes we need to start again. Because at the end of the day, everybody deserves the right to a clean and comfortable mouth. That's somebody that was in our hospital, very easily. I was able to just brush their teeth, but nobody had done this, and this isn't acceptable. And also, mouth care is more than common sense. A lot of people say, well, isn't mouth care just a bit of common sense? There's a lovely selection of dentures there. I'm sure none of us would put that in our own mouth and would be horrified if we fished it out of somebody's mouth that we cared about. This is all bacteria. This is not good stuff on these dentures. It is going to be having an impact on people. So it's really important. So I also wanted to just, when I talk about Mouth Care Matters, the programme finishing, I know that the South East have been excellent, and they've got their own Mouth Care Matters team, and it's by Janine Andrews and Harriet Bully Snell. And I wanted to make sure that people are aware that there is work going on locally, and I put Harriet's email in, highlighted there, because I just wanted people to, to be aware that they are doing some great work about improving Mouth Care Matters standards. So that's it from me.